Constant watering, sticky eyes, or a tender lump beside the nose often points to a blocked tear duct. Tears normally drain through tiny openings in the eyelids, into a small sac beside the nose, and down into the nasal cavity. When the duct narrows or blocks, tears back up and overflow, and the stagnant sac can become infected. Dacryocystorhinostomy, or DCR, creates a new drainage pathway between the tear sac and the inside of the nose. Doctors commonly recommend DCR for persistent watering, recurrent tear sac infections, or a visible lump from a blocked sac. In external DCR, the surgeon makes a small skin incision beside the nose to reach and open the tear sac. In endoscopic DCR, the surgeon works entirely through the nostril, using a thin telescope, leaving no facial scar. A soft silicone tube is often placed through the new pathway to keep it open while healing. Expect mild bruising, a stuffy nose, and some soreness for a few days, usually managed with simple painkillers. Bruising fades over 1 to 2 weeks, and the silicone tube is usually removed in clinic between 6 and 12 weeks. Published series report success rates commonly between 85 and 95% for both external and endoscopic DCR. Risks include bleeding, infection, scarring of the new opening, and rarely the need for revision surgery. In babies, most blocked tear ducts open on their own in the first year, often helped by gentle tear duct massage. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.